Welcome back, everybody. We're here this morning with Dr. Marie Walker from the Rockford Spine Center. Now, we had you on before, and the interview was too short. We needed more time to go over all the different things because so many people have back pain, and so many people just ignore it or say, I don't need to deal with it, and that's not the right way to handle that, right?
Right. It's actually quite common. 60 to 80% of the population will experience a significant bout of back pain in their lifetime.
So there's a lot. And there are a lot of different reasons why it could pop up.
Right. A lot of times it can be an acute injury where you pull a muscle or you throw your back out, but a lot of times it's just something that creeps up on people. It can be a chronic issue for a lot of people.
Now, what are some of the reasons then that people don't get this checked out?
Yeah, that's a good question. I think a lot of people figure, well, this is just my back, and I just need to live with it. Yeah.
Yeah, I actually had a chronic condition in my foot, and same kind of thing. It took me a long time to get it checked out because I was like, oh, that's just how I am, and it didn't occur to me, oh, there's a solution.
Right.
I could fix
there may
this.
be something that you can do. Yeah.
All right. So, what are some of the most common causes then of the back pain that most people are affected by?
Well, by far the most common pain generator is muscle. And like I said before, you could either pull a muscle or it can kind of creep on you gradually, and that's usually related to weak muscles and endurance of your back.
Really? So is that just a matter of exercising more if they're just weak?
That's a big part of it, yep, that you just need to work on your core strength.
How do you exercise your back? Because like when I exercise, like I'm doing cardio and then I'm like lifting weights, and I don't know how to exercise back there.
Yeah, it is a hard, well, there are some focal things you can try. You probably, if you've had significant back pain, you might want to get it checked by the doctor to clear you for exercise.
Okay.
But if the doctor says, oh yeah, you're fine to exercise, then you can try Pilates or yoga. It's usually a muscle imbalance issue where you have some muscles that are tight and some muscles that are weak, and you just need to.
Well, and if it's happening gradually over time, this is what happened with my foot. It was kind of like, something's not right, I don't know what it is, and it got worse so slowly that you don't realize it's getting worse all the time.
Right, and you just learn to live with it, but there may be something more you can do. Yeah.
Yeah, it's so important to look at. Now, so muscle is the most common cause. How do you pull a muscle in your back? Is it just you're reaching too far for something, or? Yeah,
you strain. I mean, it sometimes can be caused by an underlying weakness, but it's usually improper techniques in lifting, or you're lifting something too heavy.
Okay. What limit should we be looking at for lifting things?
Yeah, it depends on what your body is strong enough to take. If you have a heavy manual labor job, you probably can frequently lift 50 pounds, no problem. But if you're not used to doing that, a lot of times people will do it either moving furniture.
Okay. Well, yeah, I mean, yeah, if you're used to lifting stuff more, then your strength is obviously built up. My sister has a very heavy baby that she carries around on her hip, no problem, and I hold tests for 5 minutes, and I'm like, okay, she's too heavy, but because I'm not used to that.
Exactly.
So it's something that, the less you do of it, the more easy it is to strain yourself then?
Exactly.
Okay. What are some of the other causes then of back pain? Because muscle is the most common, but that doesn't cover everybody.
Right. You can herniate discs in your back. And that's probably the second most common cause. There are other causes. There are different types of joints. You can get arthritis in the joints.
In your back?
In your back.
Because whenever I hear of arthritis, I picture hands.
Yes. That's a common place too, but you can definitely get it in your back, and that can be a pain generator. Rarely is there a tumor or infection or some more serious cause of back pain, but that does happen as well.
Okay, so it's definitely worth, getting it checked out if you're not.
If you're not getting better and if it's severe, yes.
Okay, can you tell then, like, what it is? Like, can you feel it? Like, oh, this feels like a muscle problem. Like, how can you tell what it might be on your own?
That's probably hard to do without really knowing a little bit more about, when we, as physicians, examine you, we kind of, there's certain movements and certain activities that aggravate the different pain generators, and we can kind of help tease it out for you. If things aren't getting better, it might make sense to go to a doctor.
Does some pain go away on its own?
Yes, actually, the vast majority of back pain does go on its own, so you don't necessarily need to see a doctor right away. You can just try some things like heat or ice, over-the-counter analgesics or painkillers like ibuprofen or naproxen or acetaminophen.
Yeah.
We usually do recommend the ice first for the first couple weeks, and then heat or ice, whichever feels better.
Well, how long are we supposed to allow before we say, okay, that's too much? Because, you know, if I give it 3 weeks, is that, you know, and then it's still not gone, or do I need to give it 6 months?
Right. Well, you know, I would say if it's still going on after a few weeks and significantly limiting your daily activities, it's time to get it checked out.
Okay. Let me ask you this, too. My sister growing up played soccer, and she ended up in her early 20s with a lot of back pain, and they said that it was common among kids who play soccer, and she had had it through her teen years and didn't realize what it was. So is this something that parents need to be looking for in their kids?
Yes, there's a common fracture, which is, I guess, one of the other pain generators I didn't really, or causes for back pain I didn't bring up. It can be a fracture, and they're very common in teenagers. It's usually not caused by one specific trauma. It's usually repetitive.
Gotcha.
Sports activities that can precipitate the fracture, and it's usually not a bad thing where your spine is unstable and you're going to paralyze yourself, but it certainly can cause significant pain and should be looked at. Yeah.
Well, because we assume that sports are good, like, oh, your kid plays 3 sports, that's awesome.
But if your kid is having back pain, they're not able to play their sport with it, there may be something serious going on.
At what age do parents need to be looking for that then?
It usually occurs just in the teenage years, so I'd say probably the average is 12 to 18 years. Old.
Just to kind of keep an eye on it. I know with my sister, she kind of, you know, she's a very easygoing person, and she just kind of put up with it.
Right.
And so do parents need to also be talking to their kids about when to speak up, or how do you approach that subject?
Yeah, absolutely. I think they should let the parents know if they're having pain, and if you catch it early enough, sometimes you can brace them and the fracture can heal better. You know, one could argue that they could fracture it again because 20% of the population actually has a pars defect, so there's thin area of the bone that is prone to these fractures. So even if the fracture would heal, it could break again. But the good news is they don't need surgery 99.9% of the time, and the spine's not necessarily unstable. The fracture can heal, whether that heals together or it heals separate. You can get pain relief with time.
So 20%, so that's 1 in 5 of us who have this
defect.
Extremely
absolutely.
common. Almost not even a defect, right? It's just like a trait.
Right.
Or is it, I mean, because it causes problems. Is that
right, so we still consider it. But yes, it's so common, and sometimes people don't even realize that they broke their back as a teenager till they get x-rays as an adult.
Isn't that interesting?
Yeah.
That's very interesting. What about older people? At some point, should we be expecting a certain amount of back pain with age? Or even when you're 70, should you be like, oh, that's a red flag, I need to get it checked out?
I would definitely say that back pain is more common as we get older, and it's, again, the 2 most common causes, muscle weakness and arthritis.
Okay.
And that just, you lose muscle mass as you get older, and you get arthritis as you get older.
Okay. So I guess the question is there some point where you should just be putting up with it, or is it something where you should always be kind of aware of, like, oh, I need to change this?
Yeah, I mean, I think there's a lot of things you can do preventatively to keep your muscles strong, and, you know, there's not a lot you can do to prevent arthritis, but there's certainly things you can do to try to relieve the pain from arthritis.
Like, is that something that people should be looking at doing in their 30s and 40s to push it off, or is it like once you get to that retirement age, then like, okay, now I need to work on this? Like, when is it best to start those things?
I think it's best to start it earlier as a preventative thing, and sometimes I have a hard time getting my older patients to get into a regular exercise routine because they're not used to doing that, you know, and it's hard for them to create a new habit of exercising every day.
I think it's hard for most of us to want to exercise every day. That's not easy. You have to force yourself. But you know, I'm always glad when I do it. I'm like, oh, I'm so glad I made myself do that.
Right.
All right. We do need to take a quick break, but when we come back, we're going to talk about how you know when it's time to actually go to a doctor, where these home remedies are not enough. Again, we're here with the Rockford Spine Center, Dr. Marie Walker, and we'll talk more with her about that when we come back.